Good morning. In honor of the World AIDS Day, which was on December 1st, we'll be talking about HIV funding disruptions, transforming AIDS responses, because this is something that's really critical and topical and affecting our plans to really see how we can end AIDS. Good morning, Professor Akanmu. It is always a pleasure to have you here with us in the program.
Good morning. It's my pleasure to be here with you too.
Thank you. So we're talking about, in honor of AIDS Day, we're talking about the theme, HIV funding disruptions, transforming responses. Now, let's just start at the beginning. We always talk about AIDS. If we can just give a quick synopsis of what is AIDS, what it means, and what it actually means to be a patient on HIV, with HIV/AIDS, requiring treatment. If we can just talk about that, so we can start from that perspective.
So, when we say AIDS, it simply means acquired immunodeficiency syndrome, which is referring to the opportunistic illnesses that an individual is unlikely to have if God-given immunity has not been damaged. So we have a situation where a virus exists, enters into the human body, and damage or kill the cells of the human body that protect us from varieties of devastating infections, fungal infections, bacterial infections, viral infections. These viruses can damage the God-given immunity that protects us against those infections. And when those infections come around and they manifest themselves in variety of disease conditions, including esophageal candidiasis, including painful herpes simplex infection, including some type of cancer, like Kaposi sarcoma, and including a number of horrible chest infections we call pneumocystis jirovecii pneumonia. These are the types of diseases that come up, and they don't come up except immunity has been damaged. So this virus has damaged God-given immunity, and we are no longer able to protect ourselves against those disease conditions. They begin to manifest in different forms in the human body. Then we say you have AIDS. So we know when you have AIDS, definitely the virus that damages your immunity is there. That virus, we now know it very well today, that virus is called HIV, human immunodeficiency virus. In fact, that HIV, the way it got its name, human immunodeficiency virus, is the fact that that particular virus has two important properties. Property number one, that virus infects human beings only. Animals closer to human beings are not affected, cannot be affected by that particular virus. If animals that are very close to human beings will have immunodeficiency virus, another virus is responsible for it. It is called simian immunodeficiency virus. So this virus specifically infects human beings, and we understand today what is it that it can only infect human beings. But when it infects human beings, the only thing it's able to do that is so devastating is that it damages our immunity. And that is why it is called human immunodeficiency virus. Takes away God's given immunity, and it begins to express varieties of disease condition that we call AIDS. Over.
So now, what we're talking about is the treatment. Obviously, a person contracts HIV. You can tell us how they contract HIV and how they progress to the AIDS state, and what the treatment normally does, and how it protects us in general, and is really providing respite with the new drugs that are being given and actually stopping the AIDS epidemic?
We know you cannot have disease called AIDS if you have not contracted the virus called HIV. That is standard. We also know that as at the time that you are exposed to the virus, you cannot develop AIDS immediately. It takes quite a while from the time that you contracted the virus before AIDS begin to manifest. So today, we do not wait to make a diagnosis of AIDS, unlike in the past, in the 80s and the 90s. We do not know what the virus is that is causing the AIDS. We wait on the disease manifest. But today, we don't wait for anybody to show us the faces of it before we diagnose that tomorrow, if something is just not done now, you eventually develop AIDS. So we now have test technique by which you can say somebody has already contracted HIV, although it's not started manifesting symptoms. So today, what we want to diagnose is HIV infection. We really do not want to diagnose a disease quantity, a disease entity called AIDS. No. So individuals that contracted AIDS, usually that contracted HIV, usually we say this virus pass from human being to another human being. Simple. And the most important mode of transmission is sex, whether heterosexual sex or homosexual sex. You have other means of transmission, not common today, and we don't want to hear that today, that you are transfused with blood and then you become HIV infected. This has happened several times in the past, but can no longer happen today, because for anybody to receive blood or blood components, anything that is prepared from blood, the blood that is going to be transfused to another person must have been thoroughly screened and known to be HIV negative. So people that are going to become HIV infected today are more likely to still be acquiring it from the traditional mode of transmission, which are sex by heterosexual modes or sex through homosexual means. These are the major means today by which people contract the virus. It moves from one human being to another human being. Rarely, you can have it transmitted through other means, including transplantation, transfusion, but we don't expect that to occur today because all services where blood is given have been updated in terms of the technology to appropriately screen blood, and we can no longer today accept acquisition of HIV from errors of blood transfusion.
So the person gets HIV from another person, but now with the kind of medication we have, we can stop them from getting AIDS, can't we? And we can stop them from transmitting it to others, can't we?
Exactly. That is why we say what we want to be diagnosing today is not AIDS. What we want to diagnose is HIV infection. And of course, when you begin to take what we now have as antiretroviral drugs, what the drugs do in our body is that it does not permit that particular virus, does not permit it to replicate itself. We know about the viral replicative cycle. We know about the point in the viral replication cycle where drug can be targeted at. And so we now have many target points that that drugs have been developed to. This point has been developed, drug has been developed to it. That point, drug has been developed. This other point, drug has been, and you can actually combine 3 different drugs targeting different locations in the viral replicative cycle. And that actually makes the so-called antiretroviral agents so powerful in suppressing viral replication, to the extent that an individual that's HIV infected today, when you collect their blood for testing of the virus, it's as if the virus is no longer there. We call it virological suppression. In fact, we will say target, not detected, meaning that we don't even have traces of virus circulating in the blood. And when that happens, it means the capacity of the virus to damage immunity that God has given to us has been taken away. And therefore, that individual will achieve what we call all the goals of antiretroviral therapy. The first and most important goal is that we look for the virus in your blood, we don't see it. The second goal is that the immunity that has been damaged, there's a recovery or immune reconstitution. Your immunity comes back. The third goal is that because your immunity comes back, you are now able to fight diseases, then you become clinically well. So we call it virologic goal, immunologic goal, and clinical goal. But there's a fourth goal of giving the antiretroviral drugs, because when the virus is no longer detectable, that you have achieved the virologic goal, your capacity to infect a sex partner has also become zero. This is what we refer to as the epidemiological goal. And we have said that for every one person that is HIV infected who is receiving effective antiretroviral therapy, 5 to 10 new infections has been prevented from occurring in the general population. So we have 4 major goals of giving antiretroviral therapy: virologic, immunologic, clinical, and epidemiologic.
Fantastic. Thank you very much. Thank you, Prof. I think that was very important, very, succinctly explaining how important the drugs therapy is and how effective it is in general. But and I remember speaking to you last year, and we were very excited with the way the drugs were treating HIV. We're looking at the AIDS ending. Can you tell us about what happened? Because after we had the crisis of USAID and the funding being removed. So what has happened since that time? Where were we at the beginning of the year? What happened during the crisis, and where are we now?
Thank you, Dr. Ajayi. At the beginning of the year, we were talking about functional cure for HIV. Functional cure in the sense that we know you have the virus, fine, but we also know that the virus is just seated there as genetic material of the virus within your own genetic material, but that the virus is going to be found in your blood, you can transmit to another person, will not happen. So the functional cure we are talking about, by the year 2030, we will no longer see new HIV infection, because those who are infected have been rendered incapable of transmitting the virus, because the virus is not found in their blood, it's not found in their semen, it's not found in their vaginal secretions, because of the effectiveness of the antiretroviral drug. So you that is living with the virus, you have the virus, you're on antiretroviral therapy, you will die one day, but your death is not going to have anything to do with the virus that you have. And you will not be able to transmit that virus to another person. So we believe that if no new infection is occurring, then we will say we have achieved epidemic control. And if you that is living with the virus, you cannot infect another person, and the virus will not have any clinical effect on you, we will say you have achieved functional cure. And that is where we were at the end of the year 2024. And we are going to be asking for more. That we knew that functional cure is already achievable, and by the year 2030, we might be able to declare that. But what the people living with HIV and AIDS still want to hear, that thank you for the functional cure, But I want to wake up one day and see that virus is not in my body at all. And then we want to be talking about the cure agenda, removing the genetic material of the virus from human genetic material. That is what the scientists want to focus on, what they call the cure agenda. But we were satisfied, at least for the first time, that functional cure, by its definition, is achievable. We're already seeing the sign that is going to be achievable by the year 2030. But all of a sudden, February this year, we had a big jolt that was going to reverse all the gains that we have had in antiretroviral treatment program. And that was the major funder of HIV program in the world, the US government, through its PEPFAR program, US President Emergency Plan for AIDS Relief in Africa and the Caribbean. What is shortened or christened as PEPFAR. We had a stop work order from the US president, and it was a huge panic because drugs can no longer be moved from warehouses to where they are going to be used. The one that we have in the clinic, we can no longer give the way you normally give some people 3 months drug, give some people 6 months drug. We started sharing drug for people for 2 weeks, and it was a big commotion. And if people have not prevailed on the US government at that time, and the stop order that was given was not reversed, to have been not just in Nigeria, nearly everywhere in the world. I can tell you comfortably that 65% of all the money that is being used for treatment of HIV/AIDS program in the world as we speak today is coming from the US government. And that stop work order was a big jolt that we thank God for those who are the lobbyists, people who know what to say it, how to say it, that got the government of the United States to reverse that order within a period of 2 weeks, but it was with a caveat. I give you 90 days to go and know what to do. When the order was lifted, it was lifted only for 90 days. Please, within that 90 days, know what to do. But it was not all the program areas that was terminated that was restored. Some areas were not restored, but the most important areas of HIV program was restored. That is making drugs available for the people who are living with the virus, and of course, moving the drugs, all the list of moving the drug up and down. And one area of the laboratory that is important, monitoring the people who are taking the drug to be able to show that the virological suppression is still there. Those were restored. But there are a number of other areas that were not restored. And that was actually a big problem. That big problem was in the area of the categories of people. 1% of the general population who have a different form of sexual attraction, and that 1% of general population are contributing more than 20% infections. The government of the United States didn't want to hear anything about them and said not one dime, not one cent of US government money should be used to provide what we call prophylaxis for what we call the key population, the MSM population. You should not spend a dime. But we in the country, we realize that that is also very dangerous. We are looking to a situation where infection will stop moving from one person to the other. And this particular population, they are small in number, but they are more than 20% of new infection. That's a big problem. And we call on the Nigerian government. This is a small gap that you need to fill in. And I'm able to tell you, Pamela, that the government of Nigeria responded immediately by February, March 2025. The Nigerian government voted big amount of money, I think up to $200 million for Nigeria to start procuring that type of drugs that is needed to prevent this group of people from acquiring the virus and from transmitting the virus from one place to another. That part of money is also being used to ensure the logistics of movement of those drugs. We have more than 2,000 facilities in Nigeria where these drugs have been distributed. To bring the drug to the country is one thing. To move those drugs from warehouses to nook and crannies of Nigeria where it's going to be useful is a completely different thing, what they call last mile delivery.
Now,
and we realized that we
we
didn't have the logistics.
I had to have to jump in. We only have 2 minutes left to the program. So I need you to quickly wrap it up and let us know how we have moved now and where we are now and what we want for the future in your last words, because we only have 2 minutes left. This has been very...
Where we are now is the fact that we must give kudos to the US government for reversing that order. So we are fine. Where we are now, the government of Nigeria has stepped in to block this, to block the small gaps, to fill in the gap in the areas the US government doesn't want its money to be spent. Where we are now is the continued effort to ensure that people are still screened, because we want to identify everybody that is living with the virus and deliver antiviral drugs, because we are still targeting that Nigeria will be part of the countries in the world who will be able to say we have ended HIV epidemic in our country. And the definition of ending HIV epidemic is that we will test for a whole 1 year and we're not going to be able to get one new infection. That means we have ended HIV epidemic. And the rest, people that are actually living with the virus, they continue to live with that virus till the end of their God-given lifespan. That is where we are now.
Wow. I don't think we have any more time, but just in case, is there any wish that you want to put out there?
If there's any wish that I want to put out there, let people still know that HIV infection is still out there. We are happy that it is the flame of HIV infection is dwindling. Care must still be taken so that you don't become HIV infected. I want it to be out there that HIV kills no one again. And the so-called stigma, I don't want to sit close to somebody with HIV, or if I smile to somebody that has HIV, I'm going to become HIV infected. That's a myth. It doesn't happen. Husbands have sex with their infected wives, they don't become infected any longer because the virus is not transmissible. You are a woman, you are living with the virus, baby will develop inside you, that baby will come out HIV free. These are things that have happened today. There should be no stigma for anyone today as living with HIV and AIDS. And it's a good thing that you know your status. Go out there, request for the test, and if for any reason you become HIV, you are tested positive, be so sure, be rest assured, antiviral drugs are available that will keep you 100% suppressed, and you're not going to be able to infect a sex partner. That is where we are today, and people no longer be afraid of HIV.
The drugs are still free and available at the centers. Thank
you. The drugs are still free at all centers. Drugs are still free at all centers. You don't pay for antiviral drug, but you may have to pay for doing the test. You may have to pay for monitoring of effectiveness of the test when you come to the facilities. But for you to pay for drugs, that is not true.
Thank you so much for coming. It's so important to clear up what is going on in our world today as we move forward in this fight against HIV. Thank you so much.
Thank you for watching. Please like, share, and subscribe for new video updates.